morning. We're going to go over some infection control information. Most of this is re-education. We have been educated on this previously, but because of what is going on with COVID and education-wise, we want to re-educate and have this ongoing. So the first thing we're going to talk about is the equipment for emergency crash cart. Denise had a meeting previously regarding the crash cart, AEDs, and so on and so forth. So this may be a review for you. However, I'm going to go over some of this information again. So equipment for emergency crash cart needs to be checked daily, every shift by the charge nurse. All equipment is to be checked for functioning. We plug it in. If it's not working, we replace it immediately. For example, the suction machine. During dining room time, when the residents are eating, we go over to the suction machine, we uncover it, we plug it in, and we make sure that it's working, it's functioning properly, and we also check for any kind of expired dates on the supplies. Any missing supplies or equipment must be replaced as soon as possible. Once crash carts and suction machines are used, it must be sent down to central supply for cleaning and to be restocked. I gave you a list of all of the supplies that are on the crash cart. Next thing we're going to do is a lesson plan on calling for a stat code blue versus a stat nursing supervisor. We have done this numerous times. Once again, we're re-educating. So DNR is do not resuscitate. It's a signed consent, a legal document with an order by the physician not to attempt CPR in the event a resident suffers cardiac or respiratory arrest. No chest compressions. That's exactly what it means. The following identifiers should be verified prior to initiating CPR. The orange ID bracelet, that's DNR bracelet, do not resuscitate, no CPR, check both arms thoroughly, legs, wheelchair. We can identify the resident, but we need to make sure that there is no bracelet that's orange on there. In addition to that, we're not just going to check for that for an identifier. We're going to go into Sigma. We can look in there and check the orders for advanced directives. That's always on top. The orange circle that's next to the resident's picture in the Sigma profile. The orange circle means that it's an alert that they're a DNR. We also have a DNR list that's put out by social work. It's an orange binder. And in that, we have an updated list of all the DNRs for every single resident that's in the building. We also have a MOLTS form, and you can also look for the care plan. And also we have orange labels that are on the spine of the shadow chart. That would be the last resort. So there are many identifiers to check. When a resident is unresponsive, you must determine if they are or if they are not DNR status using the above identifiers. When you have verified their status, if they are DNR status, we're going to dial the phone number *8999. We're going to announce nursing supervisor stat, and we're going to announce the building and the floor. For example, Woodcrest 2. We're going to announce that 3 times overhead. If they are not a DNR status, then we're going to do *8999, code blue to the building and floor, such as Brookville 2. So code blue, Brookville 2, we'll do that 3 times. Someone is to stay with the resident, of course, at all times in the emergency. Now when we have falls, when a resident falls, you're to make sure someone stays with the resident at all times. A nurse should be called immediately. The resident's not to be moved until an RN comes to assess the resident to determine if they are to be moved. When we dial *8999, please do not say emergency or as soon as possible. We're going to say nursing supervisor stat, Brookville 2. At no time should a name or room number be announced. This is a HIPAA violation. Now the code blue protocol during COVID-19 pandemic. We are to determine if the patient or the resident is a DNR or a full code by going to the appropriate identifiers that I just mentioned. And once we determine, we can call, any nurse can initiate this call. So we're going to dial *8999 for a full code, code blue 3 times, including the unit. Do not go through the operator. Sometimes it takes a little bit too long. The message could be misconstrued, so we want to do it ourselves. Star 8999, if a DNR, supervise the stat 3 times, include the unit and the floor, and do not say emergency. A full PPE must be worn with a fit-tested N95. Emergency PPE for codes is located on the bottom of the crash cart. Supervisors, charge nurses will delegate. They're going to assure that the PPE is given to directed essential staff for that room. We're going to get a crash cart. We're going to get the AED machine. We're going to call 911. We're going to try to start the transfer paperwork. We also are going to make sure that respiratory is there, and if the respiratory is not there, we're going to call a stat code that they must be there in attendance. Vital signs to be started immediately. Do not start chest compressions until you have donned on a fit-tested N95 mask, the gown, the gloves, and the eye protection. CPR to be initiated. Continue compressions until the EMT arrive, and be prepared to communicate vital signs and give transfer paperwork. You must now turn the code over to the EMT when they do arrive. When we have a code, we want to use the nurses that are from that building, so they must report to the code, and of course all the supervisors. So for example, if Brookville has a code, I'm going to utilize all my nurses in that building and all the supervisors. I don't want other nurses coming from the other buildings. Okay, the next thing we're going to talk about is the PPE multi-use. Once again, this is a re-education, and we've spoken with this before about our PPE. Masks and N95 respirators. Fit testing will be provided for N95s and to be stored in brown paper bags or any dry compartment, no Ziploc bags. Employer will provide their own paper bags thereafter. Face masks and N95 respirators may be reused until they are visibly soiled or if it's difficult to breathe through. Bring N95 masks to central purchasing or infection control for replacement. Carefully remove and store your mask and respirator when not in use. Masks are always to be worn throughout the facility. Always perform hand hygiene before donning and doffing to minimize contaminating the devices. Wear N95 for COVID-specific residents. Apply a blue face mask over the N95 so you can preserve the N95 and discard the surgical one. When tending to COVID-positive residents, N95 masks are mandated. Eye protection, how to clean eye protection equipment. When face shields are not available, use reusable safety glasses or goggles with proper cleaning. While wearing gloves, carefully wipe the inside of the outside and the outside of the face shield or goggles using soap and water. Use the paper towel to dry, and the friction will clean it very good. Remove gloves and perform hand hygiene. Eye protection is to be taken off in the resident's bathroom prior to leaving the room to be cleaned. Gowns, how to remove a gown for reuse. No gowns are to be worn outside of residents' rooms or throughout the facility. Precautions, specific PPE are to be worn in residents' room, not in hallways. Paper and plastic gowns can be reused if they're not visibly soiled per resident. Discard gowns in room and leave in residents' room tacked up on a board for reuse for that day. Label your gown for the day. After removing dirty gloves, carefully untie the gown and remove it by gently pulling forward at the sleeves. So always go from the back because that's the clean area. Hang the gown in an open area and avoid having the gown come in contact with other garments. So that's going to be each shift. So when you're at the end of your shift, you could throw your gown away and the next shift will start their gowns. As per the policy, residents that are on droplet contact precautions must have the door closed to their room. If the resident is non-compliant or if the resident is not on a safety full precaution, that is on the safety full precaution, you must care plan the reasons stating why the door for droplet contact precaution door is not closed. When residents are cohorted, in addition to the door being closed, the privacy curtain must always be drawn between the residents. Residents outside their room should always be wearing masks, and if they're non-compliant, they must be care planned. Now, hand washing. Hand washing is always 20 seconds. Singing happy birthday, sometimes you sing it too fast. So I think the best deal is to do 1 Mississippi, 2 Mississippi. So don't forget to wash your hands. Make sure prior to washing your hands that you have paper towel and you have soap. You're gonna wet your hands, you're gonna apply the soap. You're gonna lather and scrub for 20 seconds, and then you're gonna rinse your hands for 10 seconds. Always make sure that your fingertips are pointed down. You're gonna dry your hand with paper towel, discard the paper towel, take a separate paper towel, and turn off the tap. This is the sign that we see on the doors for all the Precaution residents. Before entering, speak with your nurse, droplet contact. However, we all know that this means precaution. The next thing is your donning and doffing your PPE. So, number 1, first, always perform hand hygiene. Number 2, you're gonna put your gown on and you tie it. 3, your respiratory mask, you're gonna put that on. Number 4, you're gonna put your eye protection. And lastly, last to go is your gloves. Now, doffing for your PPE, you're gonna take the dirtiest off first, which is your gloves. Then you're going to take your eye protection off. Always take it from the back so that you're not touching anything that's dirty. Your gown comes off next. Then your respiratory protection. Always make sure you take your mask off from behind your ears. Don't touch your mask. Next thing is hand hygiene. You always clean your hands after doffing your PPE. The next thing that we're going to talk about is infection control. Okay, so chain of infection. A sequence of events, sequences of elements that allows infections to be transmitted occur. Breaking any of the links in this chain will help stop the spread of infection. So I have a little chain of infection here, which you have your organisms, your reservoir, your portal of exit, transmission, portal of entry, and susceptible hosts. So we're going to go over those. So your infectious agent is your microorganism. That could be bacteria, viruses, fungi, and parasites. Next, you have your reservoir. That can be humans, animals, and the environment. Your portal of exit, this is the way that the infectious agent leaves the reservoir. Method of transmission, the route by which the organism is transmitted to the host, which varies by organism. So you got contact, you have droplet, airborne, and bloodborne. Some agents are transmitted by more than one route. Then you have your susceptible host, a person who lacks the ability to resist the invasion of an infectious agent. Susceptibility increases and compromises the person's ability to protect themselves. Compromised immunity, presence of medical devices that bypass the body's natural defense barriers, their age, and non-intact skin or mucous membranes. Contact transmission. Contact is the most common way infection is transmitted from one person to the other. It can be direct or indirect. Used for antibiotic resistance organisms that are easily spread by direct contact from person to person or from environmental services, for example, MRSA, VRE, herpes, or C. diff. Direct transmission. Infection is transmitted from one person to another through direct physical contact. Then we have droplet transmission, which could be influenza. Blood or body fluids from an individual enter the caregiver's body through a cut or abrasion in the skin, sneezing, coughing, or talking. Mites from scabies infected patients are transferred to the skin of a caregiver while they are having direct ungloved contact with the patient's skin. And a healthcare worker develops a sore on his mouth after contact with a patient with herpes simplex virus. Indirect transmission involves the transfer of an infection through a contaminated object or person. Many microorganisms can live on surfaces for extended periods of time, even hands not properly washed. Properly washing hands is essential. Use soap and water hand washing instead of alcohol-based product when visible soil is present. A provider touches an infected body of one individual and then touches another individual. That was indirect. Airborne transmission occurs by the distribution of either airborne droplets or small particles which can be inhaled by another person. These airborne germs are tinier and lighter than droplets, allowing them to travel through ventilation systems and can live a long time in the air. TB used to be the one that we would use for example, but now we have an example of COVID-19. Bloodborne pathogens. Disease-producing microorganisms spread with blood or other body fluids contaminated with blood from an infected person. Infectious agents can live in the bloodstream and other bodily fluids that contain blood components. Mucous membranes found in the mouth, vagina, or rectum may also allow germs to spread through contact with blood or secretions containing blood. We have standard precautions based on the principles that all blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes may contain transmissible infectious agents. So the transmission of infection, once again, is the reservoir, the portal of exit, method of transmission, and the susceptible host. Infection prevention. Hand hygiene, single most important practice to reduce the transmission of infection. It's an essential element of standard precaution. Alcohol-based products are appropriate for use unless your hands are visibly soiled. If hands are visibly soiled, wash them. After several uses of alcohol-based products, you should wash your hands with soap and water because you usually do have that filmy feeling on your hands. Always use soap and water when dealing with C. diff. Personal protective equipment is known as PPE, which is your gloves, your gowns, your masks, and your eye protection. The multiple drug resistance organism, which is known as MDRO, is MRSA, VRE, and gram-negative bacilli, are infectious bacteria that have developed resistance to medications typically used to treat infection. The option for treating individuals with these infections are often extremely limited and have side effects. The transmission precaution used for MDROs is contact precaution, and that's sufficient. So standard precaution is our universal precaution, and it's what we do with all residents. Usually use gloves when handling soil, linen, or body fluids. Contact precaution goes one step further, gloves and gown. And then your isolation precaution, create barriers between people and germs, which is gloves, gowns, eye protections, and masks. Thank you.